Good morning, everyone. I am Dr. Gerald Hiron, and I am tasked to deliver lecture on histology of the endocrine system. Now, before we discuss all the endocrine organs, these are an overview of the endocrine organs. Let's start with the pituitary gland or the hypophysis. Actually, this is the master gland of our body. Next, we have the pineal gland, your thyroid gland, your parathyroid glands. Your pancreas has two functions. You have the endocrine and exocrine functions. And the endocrine part of the pancreas is what we call your islets of Langerhans. The adrenal glands, the testes and ovaries are actually endocrine glands. They produce specific hormones, but we will be discussing separately the testes and ovaries in the female and male reproductive system. And lastly, the placenta. Okay, as an overview of the pituitary organs, these are the following: the hypothalamus, the pituitary gland. Now, actually, the hypothalamus is not an endocrine organ, but it contributes a lot in the producing hormones by the pituitary gland. The pineal gland, the thyroid, the parathyroid glands, adrenal glands. There are some hormones that are in the GI tract, the pancreatic islets, and the testes. Okay, so let's start with the pituitary gland. It lies below the brain in a small cavity on the sphenoid bone. Directly, they're attached to the hypothalamus region by an infundibular stalk. Pituitary gland consists of two glands: the adenohypophysis or the anterior pituitary, and the neurohypophysis or the posterior pituitary gland. Okay. This is a picture, an illustration of the pituitary gland. As you can see, this is the hypothalamus connected by this infundibulum of the posterior pituitary gland. And this is the bulk of the posterior pituitary gland, the pars nervosa. In the anterior pituitary gland, it is composed of three pars. You have the pars tuberalis, pars intermedia, and majority is pars distalis. As mentioned a while ago, the description of the pituitary gland, they are situated in the hypophyseal fossa in the sella turcica of the sphenoidal bone. Okay, so let's start with the adenohypophysis or the anterior pituitary gland. That part of the pituitary gland arises from what we call oral ectoderm. That's the germ layer of origin. And as mentioned, they are subdivided into three portions: pars distalis, pars tuberalis, and pars intermedia. And we will be discussing this one by one. Pars distalis accounts 75% of the whole anterior pituitary gland, and they are composed mainly of cords of well-stained endocrine cells that are interspersed with fenestrated capillaries and connective tissue, specifically a reticular part. And in the pars distalis, there are two types of cells: the chromophil and the chromophobe cell. As the name implies, chromophil cells, they are with affinities to dye. And that dye basically is your acidophil and basophils. For the acidophils, there are two hormones that are being secreted by the acidophilic chromophil, and that is your growth hormone and prolactin. The basophilic chromophil, on the other hand, release or secrete the following hormones: TSH or thyroid stimulating hormone, your follicular stimulating hormone, your luteinizing hormone, your interstitial cell stimulating hormone, and your ACTH or your adrenocorticotropic hormone. While your chromophobe cells, as the name implies, they stain weakly and they represent undifferentiated cells. The structure and the appearance of this chromophil and chromophobe cell will be discussed in next slides. As mentioned, these are the chromophil cells. Please take note in the examination, you have to identify whether it is an acidophilic chromophil or a basophilic chromophil. Other terms for these types of cells found in the pars distalis are the following: somatotropes are cells producing growth hormone. Lactotropes producing prolactin. For the basophilic chromophils, the corticotropes release release adrenocorticotropic hormone. Gonadotropes, on the other hand, release the following: your FSH, your LH, and your ICSH. And the thyrotropes, or your thyrotrophic cells, release your thyroid stimulating hormone. Okay, next of the pars, or part of the anterior pituitary, is the pars tuberalis. This is actually a funnel-shaped region that surrounds the infundibulum. This is highly vascularized, wherein cell function is actually unknown. Next of the part of the anterior pituitary is the pars intermedia. Now, this is a rudimentary region that is made up of cords that are darkly basophilic cells that present small secretory granules. The pars intermedia follicles are actually lined by a simple cuboidal epithelium, and in that, they contain colon known as your Rathke's cyst. Now, Rathke's cyst is the characteristic feature of your pars intermedia located in the anterior pituitary gland. The pars intermedia cells synthesize MSH, or the melanocyte-stimulating hormone that will be acted upon in the epidermis of the skin. In this illustration, taken from the book Jonquera, this is the pars. This is the pars distalis, where we can see acidophil, basophil, and chromophobe cells, the one that does not contain or does not take up the stain. Okay, let's go now to the posterior pituitary gland, or the neurohypophysis. This time, this part of the pituitary gland develops from the origin neural ectoderm. Okay, that's the germ layer of origin, neural ectoderm. It consists of the pars nervosa and in the infundibulum. Hormones in the posterior pituitary, take note, they are not produced in the posterior pituitary gland. No, these hormones, the vasopressin or ADH, or antidiuretic hormone, and oxytocin, will be stored and released by the posterior pituitary when the need arises. But again, they are not produced in the posterior pituitary gland. Okay, the vasopressin or antidiuretic hormone, its function is to increase its water permeability of the renal collecting ducts, while oxytocin stimulates the contraction of your mammary glands and the uterine smooth muscle. Oxytocin class is actually responsible for induction of labor in pregnant women, as it contracts as it stimulates the contraction of your uterine smooth muscle. So usually, if you have every 5-minute uterine contraction, that means you'll be entering, that pregnant woman will enter in the state of active labor, and that is because of the hormone oxytocin. What else that we need to know about the posterior pituitary? This pars nervosa consists of modified neural tissues containing unmyelinated axons that are supported and unsheathed by these glial cells called your pituicytes. That is your parenchyma of your posterior pituitary gland. They're the most numerous cells present. The axons run from the supraoptic and paraventricular hypothalamic nuclei, have these swellings called your NB, or your neurosecretory bodies, or the Herring bodies. Now, in this picture, this is an illustration taken from Jonquera, wherein we can visualize or see the posterior pituitary gland. Cells pointed by the as indicated by letter P here, are actually our pituicytes. C stands for the capillaries, and NB is our neurosecretory bodies, or your Herring bodies. Okay. Okay, this is another picture, illustration showing you the hypothalamus up here, supplying the other anterior and the posterior pituitary glands. But the production of the posterior pituitary hormones comes from the hypothalamus. Okay, look at the anterior pituitary. As mentioned, the pars distalis constitute 75% of the whole pituitary or anterior pituitary gland, And these are the cells that are being secreted. The thyrotrophic cells secrete TSH, again, due to act on the thyroid gland. The mammotrophic cells will secrete this hormone prolactin, which acts on the mammary glands and testes. The corticotropic cells secrete ACTH, which acts on the adrenal cortex. The somatotropic cells will secrete growth hormone, which will act on all body tissues, especially the bones, the muscles, and the adipose connective tissue, anything to do with growth and development. Your gonadotropic cells secrete follicular stimulating hormone, your luteinizing hormone, which acts on the gonads, which are your testes and your ovaries. These are all pars distalis, but the pars intermedia cells, okay, the pars intermedia cells will secrete MSH, or melanocyte stimulating hormone, which acts on melanocytes of the skin. Another illustration. This is actually a very good illustration on how the pituitary gland control our body. In the hypothalamus, we have three main regulatory hormones that are mechanism. First is indirect control to the release of regulatory hormones. Next is direct release of hormones and direct control by the nervous system. Let's discuss first the direct control by the nervous system. As you can see in this illustration, they will act on the adrenal gland, but specifically, they will only act on the adrenal medulla, okay? Releasing what we call your epinephrine and norepinephrine. These are your neurotransmitters, okay? Take note of this, only on the adrenal medulla that they will act upon, thus releasing epinephrine and norepinephrine. Look at this again, the illustration showing you an indirect control through regulatory hormones. ACTH, as we all know, will be released by pituitary gland, anterior pituitary gland to be specific, right? They will act on specifically the adrenal cortex only, okay? Adrenal cortex only, releasing the following: glucocorticoids, which are your cortisol and your corticosteroid, okay? On this illustration, as you can see, production of your TSH will act on the thyroid gland, producing the thyroid hormones. Growth hormone, which will act on the liver, producing your somatomedins for it to act on the bones, muscles, and other tissues. And so on and so forth. All this indirect control through regulatory hormone. What is another mechanism of the hypothalamus is that they will direct release the hormones, no? From the hypothalamus, no? After it released that hormone, they will go to the posterior pituitary gland, particularly at the pars nervosa, wherein they will be stored and they will be released when the need arises. Okay, what are those hormones produced by the hypothalamus, which will be stored in the pars nervosa? We have the antidiuretic hormone, which will act on the kidneys, and the oxytocin, which will act on the males, on the smooth muscle, the ductus deferens, and prostate gland. While in the females, as mentioned earlier, they will act on the uterine smooth muscle and mammary glands. Okay? Okay, this is just a picture in the laboratory wherein this is your pituitary gland. In this picture, this is your pars nervosa. Okay, this is your pars distalis. And in between is our pars intermedia. As you can see, I'll give you a clue that this is a pituitary gland because of this pars intermedia characteristic feature. And the ones that are encircled are actually your Radke's cysts. So if you find that one, those are characteristic feature of your pars intermedia, meaning this is the pars nervosa and this is our pars distalis. Okay, and another most commonly asked question in the pars intermedia in the practical exam, what hormone are being released in this layer? The answer is pars melanocyte stimulating hormone, which will act on the epidermis of the skin. Okay? Right. This is just a higher magnification showing you the lining epithelium of the Rhatke cyst. These are the colloid of the Rhatke cyst. This is lined by your simple cuboidal epithelium. Okay, again, these are the characteristic feature of your pars intermedia. Okay, this is actually a picture in the laboratory. This is the pars nervosa. The one that is pointed right now is your herring bodies or your neurosecretory bodies. And the one that is encircled are all your pituicytes. Okay, they are all part of the posterior pituitary gland or your pars nervosa. Okay, so let's apply it in medicine. There is what we call a diabetes insipidus, wherein there is a characterized by low levels of vasopressin or antidiuretic hormone, and this disorder is characterized by the inability to concentrate urine. That will lead to a frequent urination and an increased thirst. All right, so next organ in the endocrine system is your pineal gland. Okay, the characteristic or the parenchyma of the pineal gland is your pinealocytes. They are described as having a slightly basophilic cytoplasm with large irregular nuclei. With sharply defined nucleoli, the main function of your pinealocyte is to secrete melatonin. Okay, and other cells, other than the parenchyma, are actually your interstitial cells. They are described as having an elongated nuclei. They stain more heavily than the parenchymal cells, which are pinealocytes, and they are found between the cords of pinealocyte and in some parts of a perivascular areas. What is the characteristic feature of the pineal gland is flash in the screen. It's the brain sands or the samoma bodies or the corpora arenacea. These are formation of a calcified bodies in the parenchyma of the organ. So the one that secretes the melatonin are pinealocyte, but the brain sands, samoma bodies, and the corpora arenacea, they are the characteristic feature of your pineal gland. Okay, what does it look like? This is the pineal gland. This is taken from Junqueira. The one that is labeled as CA right here is our corpora amylacea or your brain sands. Another picture showing you your corpora arenacea, and the one that is labeled as P here are actually your pinealocytes or your parenchyma of the pineal gland. Another picture, this is taken from the laboratory. The one that are labeled, not labeled, the one that is shown here by the red circle, no, if you can actually recognize those are brain sands, okay, or corpora amylacea. That those are a characteristic feature of the pineal gland. Okay, corpora arenacea are samoma bodies, but the melatonin, okay, the melatonin, they are actually responsible for the circadian rhythm or the sleep-wake cycle. Okay, again, melatonin produced by the pinealocyte in the pineal gland, they are responsible for the circadian rhythm or the sleep-wake cycle. Okay, next endocrine gland is the thyroid gland. This is a highly vascularized butterfly-shaped gland, as you can see on the right side of the screen, surrounding the anterior surface of the trachea, just below the larynx. Okay, in the thyroid gland, histologically, no, parenchyma or the characteristic feature is the characteristic cells is composed of millions of rounded epithelial thyroid follicles and essential lumen densely filled gelatinous acidophilic colloid. Okay, take note that the thyroid colloid contains this large glycoprotein thyroglobulin, which are the precursor for an active thyroid hormone. So basically in this picture, there, it contains millions of thyroid follicles, and inside of that, no, in the illustration figure B, The colloid here contains your thyroglobulin. And again, what is the function of your thyroglobulin? They are the precursor for your active thyroid hormones. When we speak of parenchyma of the thyroid gland, these are the parenchyma. You have the follicular cells or your thyrocytes. They range in shape from squamous to locolumbar, and they are controlled by the thyroid stimulating hormone. As you can see, the TSH is secreted or produced in the anterior pituitary gland. Okay, and again, if I ask you what is cell responsible for the secretion, it's the thyrotrophic cells, which are actually your basophilic chromophil. Where in the anterior pituitary gland, in what pars? In pars distalis of the anterior pituitary gland. Okay, what else? These follicular cells are the parenchyma. They are round nucleus. They have round nucleus, and cytoplasm is filled with secretory granules. They synthesize and secrete thyroid hormones. These are your T3 and T4, your triiodothyronine and your thyroxine. They stimulate metabolic rate. Other than the parenchyma or the follicular cells, there are other cells found in the thyroid gland. And these are the parafollicular cells, your C cells, or your clear cells. They are described as small isolated clusters of pale staining cells that they are found between the thyroid follicles. And their main function is they synthesize and secrete the hormone calcitonin. And what does it do in our body? They're responsible for the reduction in the concentration of calcium in the blood by inhibiting bone resorption. Take note of that hormone and that cells produce and the organ that is produced, and the organ producing the calcitonin. Because in the next organ, there is this hormone that is inversely proportional to the secretion of her calcitonin. Again, parafollicular cells, C cells, or clear cells secrete calcitonin, which decreases your calcium concentration in the blood. Okay, so as mentioned a while ago, these are the simple cuboidal epithelial lining of the thyroid follicle. What is found in the middle of that in the lumen is the thyroid colloid. Okay, thyroid colloid content is your thyroglobulin, which are the precursor of your thyroid hormones. F here stands for follicular cells. Okay. Okay, so this is another picture from the laboratory. This picture right here is your thyroid gland. Consists of millions of thyroid follicles. Okay, and at the center is your thyroid globulin. Sorry, colloid, which contains your thyroglobulin. Okay, and this is your parathyroid gland. Okay, another picture of your a higher magnification of your thyroid gland consists of your thyroid follicle. Okay, this is a thyroid follicle colloid containing your thyroglobulin. What surrounds this thyroid follicle are your follicular cells that secrete your T3 and T4. Okay, this one class is actually a clear cell. So if this one is a clear cell, this is also known as your parafollicular cells or C cell. And what hormone is being secreted by this cell pointed? This one secretes calcitonin. And what does it do? Calcitonin decreases or reduces its calcium concentration in our blood. Okay, let's apply it in medicine. There are two conditions that affect thyroid gland. Your Graves' disease. This is an autoimmune disorder in which antibodies produce a chronic stimulation of the follicular cells and release of thyroid hormone. Meaning, if there is a chronic stimulation, what would be the levels of your thyroid hormone? It will be increased, thus causing a hypermetabolic state or hyperthyroidism state. Hypothyroidism, on the other hand, meaning you have a reduced thyroid hormone or thyroid hormone levels. This can actually be caused by a local inflammation or inadequate secretion of TSH, meaning if you have low levels of TSH, there is no stimulation of your thyroid gland to produce enough thyroid hormones. Okay, so that will be the difference between the Graves' disease and hypothyroidism. Okay, this is an organ that is situated at the back of the thyroid gland. These are your 4 small ovoid masses called your parathyroid glands. In surgery, sometimes these parathyroid glands are accidentally being removed during a thyroidectomy. That's why before a surgeon perform a thyroidectomy surgery, no, we actually do some laboratory check, and what specific serum concentration of this electrolyte must be checked before doing a thyroidectomy procedure. It's actually your calcium. Okay, we'll explain that in a while. Okay, parathyroid glands are covered by connective tissue capsule that sends septae to the parenchyma, and the parenchyma of your parathyroid glands is known as your chief or your principal cells. They secrete PTH or parathyroid hormone. If your chief or principal cell secretes parathyroid hormone, they're responsible for increasing calcium absorption. Meaning, the level of your calcium, if parathyroid hormone is being secreted, will become increased. Okay? Increase, tataas. This is in contrast with the parafollicular cells that are being found in the thyroid gland secreting hormone calcitonin. Okay? Again, calcitonin is produced by the parafollicular cells in the thyroid gland, decreasing its calcium concentration. Whereas here in the parathyroid gland, we have the chief or principal cells secreting the parathyroid hormone, which in turn increasing its calcium absorption. What does that mean? You have an increased calcium concentration in your blood. Okay, what are the other cells? Other than the chief or principal cells, you have your oxyphil cells. They are described as having a polygonal in shape, but larger than chief cells. Its cytoplasm contains numerous acidophilic granules. Okay, this is another picture from the laboratory. PD here stands for your principal cells or chief cells, which secretes your parathyroid hormone. Okay, your O here is an oxyphil cell, larger than the principal or chief cell. Okay, this one right here, larger than the parenchyma. These cells are actually our oxyphil cells. Okay, and the rest are all your principal or chief cells secreting your parathyroid hormone. Again, parathyroid hormone, what does it secrete? It secretes your parathyroid hormone, increasing its calcium concentration. Okay, let's apply this in medicine. Hypoparathyroidism and hyperparathyroidism. Now, if you know the secretion of this parathyroid hormone of parathyroid gland, you will not be confused with the term hypo and hyperparathyroidism. Again, as a review, your parathyroid gland secretes parathyroid hormone. So from the word itself, hypoparathyroidism, there is a diminished secretion of your parathyroid hormone. Now, if there is a diminished secretion of this PTH, what will happen to your calcium level? Increase or decrease? Your answer should be decreased because this is directly proportional to the secretion of your parathyroid hormone and calcium. Thus, the hypoparathyroidism, this one will cause the bones to become more mineralized and denser due to an inadequate calcium levels. Okay, what about hyperparathyroidism? If there will be hyperparathyroidism, there will be stimulation of your osteoclast number and activity, which will lead to an increased levels of blood calcium. This hypercalcemia brought about by hyperparathyroidism can be deposited pathologically in kidneys For example, in kidneys, kidney stone could be developed, or in arteries, it could lead to a coronary artery disease, meaning there is a formation of her atheromatous plaque. Okay. Okay, question. A thyroid gland secretes which of the following hormones? A, T3, T4, and TSH. B, T3, T4, and calcitonin. C, calcitonin and parathyroid hormone. Or D, T3 and T4 only. What's your answer? A, B, C, or D? The correct answer for this question is letter B, T3, T4, and calcitonin. Another question, which of the following is true about oxyphil cells? Oxyphil cells, secretion of parathyroid hormone, letter A. B, calcitonin production. C, unknown function. Or D, it regulates T3 and T4. Right. The correct answer for this question is letter C. The oxyphil cells that are found in the parathyroid gland still has an unknown function. Okay, let's go now to the pancreas. And as you all know, pancreas has two functions. We have endocrine and exocrine portion. The endocrine portion is flashing your screen, your islets of Langerhans of the pancreas. And these are compact, spherical, or ovoid mass of endocrine cells that are embedded within the acinar tissue of the pancreas. The cells here are polygonal or rounded, smaller and more lightly stained than the acinar cells. And as you all know, your acinar cells are actually your exocrine portion of your pancreas. Okay, what you should know about the islets of Langerhans are the cells, your major islet cells. In the practical examination in histology, we will not be able to determine if this one is alpha, beta, delta, or etc. No? Major islet cells are most easily identified and studied by what we call your immunohistochemistry. And what are the cells found in the islets of Langerhans? Your alpha, your beta, your delta cells. Your alpha secretes glucagon, and it says here it's usually located peripherally. In biochemistry, when you say alpha cells secreting glucagon, its main function is to increase its serum glucose concentration, right? In beta, for beta cells, they secrete the so-called insulin, and this is the most numerous cell, and they are located centrally in the islets of Langerhans. While your delta cells, they produce the hormone somatostatin. They are scattered and they have much less abundant compared to your alpha and beta cells. This is a picture in the laboratory wherein we can see pancreas. This is the exocrine portion, and the one that is encircled by the red circle, these are all your islets of Langerhans. As mentioned a while ago, you cannot determine alpha, beta, or the different cells in the islets with an H&E stain. Usually we use immunohistochemistry. Okay, this is an illustration in Jonquera where we can see islets of Langerhans. Also islets of Langerhans. Okay, in this picture, as mentioned a while ago, alpha cells secreting glucagon are located in the periphery. No? But the most numerous are your beta cells. Some delta cells scattered and F cell are less numerous. Pancreatic acinar cells is the one that is being pointed right now by the arrow. They're all pancreatic acinus, and they have acinar cells. This is the exocrine portion, and the islets of Langerhans is the endocrine portion. Okay, this is another picture in the laboratory showing you the pancreas, and this light staining structure encircled is your islets of Langerhans. Okay, we all know this. Diabetes mellitus is actually a medical condition or characterized by loss of insulin effect and subsequent failure of cells to take up glucose, which will lead to an elevated blood sugar. And there are two types of diabetes mellitus. You have type 1 insulin-dependent diabetes mellitus and type 2 non-insulin-dependent diabetes mellitus. But in this lecture, take note that we cannot totally define type 2 as non-insulin-dependent diabetes mellitus. Okay? Why? I'll explain later. The type 1 diabetes mellitus, they are really an insulin-dependent diabetes mellitus because of this autoimmune destruction or loss of the beta cells. These are being treated only by insulin injections. They don't have production of insulin. Whereas in type 2, the beta cells that are present fail to produce an adequate levels in response to hyperglycemia. But there is a minimal secretion of insulin. Thus, okay, type 2, the management of diabetes mellitus type 2 is not purely oral medications. We can actually treat patients with metformin. These are oral medications for diabetes mellitus type 2, metformin and other oral hypoglycemic agents. But if you have patient who still have an uncontrolled sugar despite having an oral medications, you can actually treat DM type 2 with insulin. Okay, with insulin. So don't mind the insulin-dependent, non-insulin-dependent DM. You concentrate on their mechanism and how they are called type 1 and type 2 DM. The management for each diabetes mellitus type 1 and type 2 will be further discussed in your pharmacology subject next school year. Okay, another organ, endocrine organ, is your adrenal glands. These are paired organs that lie near the superior poles of the kidneys. They are flattened structure with half-moon shape, and they consist of two main layers, so the adrenal cortex and the adrenal medulla. As mentioned, it consists of two main layers. What you need to know about that is that adrenal cortex arises from this germ cell layer of origin, your mesoderm, and this cortex has three concentric zones or zona. You have the zona glomerulosa, zona fasciculata, and zona reticularis or GFR. Okay, from outermost we have G, glomerulosa, fasciculata, and reticularis. The adrenal medulla is the innermost portion of the adrenal gland, and this is adherent with the zona reticularis. What is so unique with the adrenal medulla is that it arises from the neural crest and they secrete catecholamines. As mentioned a while ago in the earlier part of the lecture, the adrenal medulla is controlled directly by the nervous system, right? From the nervous system, they directly affect the adrenal medulla to secrete catecholamines. And these catecholamines are actually epinephrine and norepinephrine. Okay. So this is an illustration showing you a cross-section of your adrenal glands. You have this capsule. The adrenal cortex is found at the outermost portion, and the innermost portion contains your adrenal medulla. Okay. Again, this is the capsule. This is the zona glomerulosa. Zona fasciculata, zona reticularis is adherent to the adrenal medulla. Okay, so let's discuss first the zona glomerulosa. The zona glomerulosa is described as having a columnar pyramidal shaped cells, which are arranged closely packed, rounded arc clusters surrounded by capillaries. All you need to remember the zona glomerulosa is that they secrete mineralocorticoids, primarily aldosterone. Aldosterone, this hormone is responsible for an electrolyte and water balance. It stimulates sodium reabsorption in the distal convoluted tubule, and they are being stimulated by angiotensin II and hyperkalemia. So if there is a hyperkalemia or hypertension, we all know that if there is hyperkalemia or hypertension, if there is a release of hyperaldosteronism, that is in effect, that it would be the effect of aldosterone. No, hypokalemia, it brings down the potassium level in the blood and it brings down the blood pressure. So they will be stimulated. The aldosterone secretion will be stimulated because of an increased or elevated blood pressure and hyperkalemia. What about zona fasciculata? Now, all you need to remember is that they occupy 65 to 80% of the adrenal cortex. They secrete glucocorticoids in the form of cortisol, and this secretion is controlled by your ACTH with a negative feedback mechanism. Again, ACTH is found or produced in the anterior pituitary glands. Okay? But what about this? If there is a glucocorticoid secretion in the form of cortisol, in zona fasciculata, there is also small amounts of production of weak androgens. So again, in the zona fasciculata, majority of its secretion are glucocorticoids with little amount of weak androgens. In contrary to that, this is zona reticularis. It comprises just 10% of the cortex, and this zona reticularis, as mentioned a while ago, they are adherent to the adrenal medulla, right? What is so unique about zona reticularis is that they primarily or majority they secrete weak androgens. We have your DHEI or dihydroepiandrosterone, which will be converted further to testosterone. But if your zona fasciculata, majority is glucocorticoids with little androgens. Your fasciculata, on the other hand, majority are weak androgens with, take note, little cortisol. Okay, so if we answer in the practical exam, if we ask you what is the secretion of zona reticularis, don't forget that it does not purely secrete weak androgens. They also produce little cortisol. Okay. Okay, what about adrenal medulla? Now, this is the central layer of the organ or the innermost part of the adrenal organ. There are modified postganglionic neuron of the sympathetic nervous system. Its parenchyma is the one that is called your chromaffin cells. They secrete the catecholamines, epinephrine, and norepinephrine. As mentioned, they have the direct effect or direct effect to the nervous system. Yeah. So this is a picture, a low power magnification of your adrenal gland in the laboratory. Okay. So as you can see here, this is from the tip of the pointer up to this area is your adrenal cortex. From this tip of the pointer up to this area is your adrenal medulla. Okay. Again, this one is also adrenal cortex, outer portion. Okay, in higher magnification, okay, if this is the adrenal cortex, this area right here is our capsule. Okay, sorry. Since this is capsulated, this is our capsule. From this tip of the pointer up to this area is the outermost layer of the adrenal cortex or zona glomerulosa. This one constitutes the 60 to 80% of the cortex, zona fasciculata. And this one that is adherent to the adrenal medulla is our zona reticularis. This is your adrenal medulla. Okay. Again, if I ask you, what is this part of the adrenal gland? This is your adrenal medulla. Secretion, catecholamines such as your epinephrine and norepinephrine. If I ask you, what is this specific layer pointed? This is now your zona GFR, reticularis. Okay, zona reticularis, and what are its secretion? They secrete majority of weak androgens and little cortisol. Okay, what is the parenchyma of the adrenal medulla? We call it your chromaffin cells. Okay, so those are the important to note in the adrenal gland. And there is this called Addison's disease. This is also known as your adrenal cortical insufficiency. This disorder is usually autoimmune in origin, and it causes degeneration in any layer of the adrenal cortex with concomitant loss of secretions in each layer. Now, question. In the Addison's disease, is there an impairment of the secretion of catecholamines? Yes or no? Again, my question, in Addison's disease, is there an impairment of secretion of your catecholamines epinephrine and norepinephrine? Yes or no? The answer is there is not, because in Addison's disease, it only affects the adrenal cortex, not the adrenal medulla. So in Addison's disease, there is affectation of the secretion of your mineralocorticoid, aldosterone, glucocorticoids, and weak androgens, but not the catecholamines. Okay, and last organ in the endocrine system is our placenta. This is actually a major endocrine gland delivering directly in the maternal blood the hormones that are essential for the continuation or continuance of pregnancy. And that hormone is your human chorionic gonadotrophic hormone. They are being secreted by the cells called your syncytial trophoblasts that are found in the chorionic villi. Next slide is showing you a picture of chorionic villi. And what is so important about the floating chorionic villi are this black or dark staining structure at the periphery of the chorionic villi. Can you recognize those dark staining structure in black? Those are all your syncytial trophoblasts. These are the cells that secrete what hormone again in the continuance of pregnancy? It's your human chorionic gonadotrophic hormone, or HCG. Again, the organ in focus is placenta. The whole structure, these are all chorionic villi, and the one that is in red circle are your syncytial trophoblasts. Most commonly asked question, hormones secreted by the cell that are encircled. The answer is HCG. Okay, that's it. Thank you, and those are your histology of the endocrine system and endocrine glands. Thank you for listening.